Hi, I'm Suzanne Stevenson, licensed physical therapist. This video I'm going to show you how to use a small ball to release tension in the TFL muscle, tensor fascia latae, a nice fancy name for essentially the front pocket muscle. So you can use a tennis ball. I don't prefer a tennis ball just because the feltiness makes it slide, but if you have a pinky ball, something that has a little bit of squish to it, you don't want anything that is too firm, that is difficult to relax into when you put pressure on the muscle. So the TFL muscle, let's get to know our anatomy a little bit. There's at the top of the pelvis, that's the iliac crest. That's part of your pelvis bone. And at the front of that is your ASIS, which is, some people might call it the hip pointer. So when we're talking about the TFL muscle, it's on the front corner, meaning it's neither straight in the front of the hip nor straight on the side. Kind of right where the pocket is in my pants, you have a little bit of a muscle belly there that travels down and turns into the IT band. If you've ever heard of IT band syndrome or someone has tight IT bands, it's part of this continual band of tissue, but that top portion is muscular and it can hold some tension and thereby pain and tenderness when you push into it. Whenever you're doing a self-mobilization, relaxing muscles with a ball or another object, you want to make sure you avoid bony prominences, meaning you don't want to roll over the greater trochanter, that bony knob on the side of your hip. That knob is actually on your thigh bone. You don't want to roll over that bony knob in the front of the hip joint, and then the crease in the front of the hip. You don't want to roll over that spot because that has a lot of tender, let me back up. It has a lot of sensitive structures like your artery, vein, nerve. It has a ligament. So you want to avoid rolling right across the point where they feel there's a crease in the front of your hip. So I'm keeping the ball to the outside of that, pretty close to where that front pocket is. Once you kind of find that position, place the ball against a wall, and you might, let me lower the camera a bit, you might see that I'm kind of tripoding the leg that's away from the wall a little bit, and that's how I can give pressure into the ball. And so whenever you do this self-tissue release or self-massage with a ball, you go through what I call a search and destroy. So I'm kind of bending and straightening my opposite leg, I'm rolling forward and rolling back. So you're first kind of getting to know where is the tenderness. You can put more pressure into it by pushing more into this outer leg. This leg doesn't have much pressure weight in it. It's kind of hanging empty. If you're putting tension and pressure on this leg, you're not going to get as much of a release in these muscles. So this side of your body, you want to try to stay relaxed, while this side is the side that's supporting you. So this is kind of, right there's a tender spot. So the ball is a little bit, for me, it's a little bit more further out to the side than in the front. So once you find a tender, tight spot, again, it's not on the bone, the top of my pelvis bone here, I have a little bony prominence there, so it's kind of nestled right behind it. Once you feel like you've pinned down in a tight, tender spot, the next trick is to go into the destroy, search and destroy. So search, you first are rolling it out, seeking where it's tender and tight. Once you find it, pin it down, then you're gonna pause to let that tension dissipate and destroy. Kind of a dramatic word for it. But the way I'm doing that is relaxing the weight of my body into the ball, which is taking me a moment to be, it's amazing how much you have to concentrate to relax your body. We often are holding tension without even realizing it. So I'm supporting with this hand, so it gives me something to push against. So I can gradually empty out any weight or tension or holding in the left side of my body. And then you stay there for anywhere from 60 seconds to 2 minutes. I've got probably about 80% of my body weight pushing into my outer tripod leg, and really maybe I have 90%. I really have little to no pressure on this leg. It's just kind of resting on the floor. I'm not standing on it at all. And when I put pressure in my hand, it helps me to relax the treatment side even more. A couple full expansive breaths is really helpful at tapping into the nervous system's relaxation response. And after about a minute, up to 2 minutes, you'll notice that initial tenderness will have dissipated, and it just feels like pressure, which is how it feels for me right now. So once you do that, you can roll off that spot. You can find, 1 up to 3 spots in a given muscle belly for that treatment. It should take no more than 3 to 5 minutes. This is great to do if you're feeling tension in that front hip pocket muscle, to release that tension. And you want to typically do this before you do your other hip exercises, so you can get a better recruitment pattern in some of those deeper hip stabilizers, the gluteus medius, the gluteus minimus. I hope you've enjoyed this video, and stay tuned for more.